Do you experience pain traveling down the back of your leg? Do you have numbness or coldness in your foot? Then it's possible that you may be suffering from sciatica. In this video, I'm going to explain what sciatica is, what causes it, as well as outline the approach I use to help people successfully overcome sciatica. Hi, I'm Dr. Jared Wilbrink. I'm a chiropractor and a certified McGill method provider. I help people overcome their back pain even when nothing else has worked, so that they can get back to living their lives without having it dominated by back pain. When it comes to sciatica and understanding what it is and what causes it, it can be helpful to have an understanding of basic spinal anatomy. Now, as you probably know, your spinal cord runs through your spinal canal, which is in the middle of your spinal column. Let me say that again. Your spinal cord, which is a bundle of nerves, runs through your spinal canal, which is in your spinal column. Now, if we were to look into your spinal canal in the lower part of your back, after having removed the back part of your spinal column, what we would see is something like this. So we would see the back of the different vertebral bodies in your low back, and between each of those bones would be different discs. At the bottom would be your sacrum, and that's what attaches your spine to your pelvic bones. Now, running through your spinal canal, you would have your spinal cord. Now, as your spinal cord descends through your spinal canal, at each level of your spinal column, there's spinal nerves that branch off and exit your spinal column. Now, it's these spinal nerves, as they exit, that join together again to form the various nerves that run through your body. Now, your sciatica nerve, or your sciatic nerve, is composed of the spinal nerves that exit from the lower part of your back. So once these nerves all join together and form your sciatic nerve, that nerve runs down the back of your leg to your knee, where it divides into two different nerves, which then proceed down your leg further and into your foot. Now, sciatica occurs when any one of these spinal nerves is pinched or compressed before it exits your spinal column. What that does is it results in you experiencing pain or other symptoms anywhere along the course of your spinal nerve or your sciatic nerve. So you might experience pain that's been described as electrical pain or burning or a sense of coldness in your foot, or a sharp pain or a stabbing pain or a pulling or tingling or even just a sense of unease somewhere in the back of your leg or your foot. There are a number of different conditions that can cause sciatica, but what's common between them all is that they all narrow the opening that your spinal nerve passes through as it exits your spinal column. Three of the most common causes are disc bulges, spinal arthritic changes, and spondylolisthesis. Now, when we look at your spine from the side, what we can see is this opening between two adjacent vertebrae that your spinal nerve passes through, which is represented by that little green circle. Now, in a healthy spine, there's sufficient room in that opening for the spinal nerve to easily pass through. Now, what happens with a disc bulge is that the disc between two adjacent vertebrae bulges backwards into that opening, decreasing the size of the opening, resulting in compression on the spinal nerve. This condition is more common in a younger population. Now, in spinal arthritis, what happens is that you get bony growth called bone spurs or osteophytes that grow off the back of the vertebral bodies, as well as bony growth on the joints called facet hypertrophy, and all this bony growth narrows the opening that the spinal nerve passes through, again increasing the chances that the spinal nerve will be compressed. Now, spinal arthritic changes are more common in an older population. The third thing is spondylolisthesis, and what that means is that one bone slides forward relative to the bone below it. So one bone slides forward compared to the bone below it. And as you can imagine, what that does is that also narrows the size of the opening, resulting in compression of the spinal nerve as it exits the spinal canal. Spondylolisthesis can be present in both a younger as well as an older population. Because there are so many different conditions that can cause sciatica, there isn't a one-size-fits-all treatment approach that works for every situation. You can't just look up the best treatment for sciatica and expect it to work for your condition. The reason for that is that different types of sciatica require different treatment approaches. For example, if you had sciatica because of a disc bulge, you're likely to find that bending forward will make your symptoms worse, whereas standing tall or even bending backwards may improve your symptoms. If you had sciatica because of spinal arthritic changes, what you might find is that bending forward actually relieves your pain, and bending backwards increases your pain. Therefore, to successfully treat your sciatica, the first thing you need to do is determine what type of sciatica you have. Then once you know what type of sciatica you have to determine what causes that type of sciatica. Once you know what causes your sciatica and you address and alleviate that cause, that will result in the compression being removed from your spinal nerves, which will allow the sciatica to resolve. As a certified McGill method provider and a chiropractor, this is the approach I use and have used to help people successfully overcome their sciatica. I help people determine what type of sciatica they have, what's causing it, and then show them what they can do to remove that cause. Often this involves modifications or adapting their postures, their movements, and their activities in some way. Now, if you're looking to overcome your sciatica and you'd like me to help you, please contact us by clicking on the link in the description below. If you know of others who may benefit from this information, please share this video with them. If you have any questions, please leave them in the comment sections below. Otherwise, feel free to subscribe to our channel. And as always, thank you for watching and take care. We'll see you next time.